Denise, welcome to PharmaComms TV and thank you very much for joining us today. Can I ask you just to introduce yourself and give a little bit of background?
I am currently managing Doctors 2.0 event services, whose purpose is to bring content to physicians at events, content that will help us progress in creating a more patient-centered world.
And how about patient-centricity? Can you talk to me a little bit about the opportunities for improvement that you see in this space?
There are many opportunities for improvement because this is a very recent concept that conferences would be the place where physicians and patients can interact as partners. First of all, physicians are looking for more information about their own relationship with patients. They realize that their medical education did not favor that kind of learning, and that today, in today's what we call flat world, it's important to give opportunities to physicians to know more about how to communicate with patients. And what better way than to create patient-included events where patients are brought to speak on an equal footing with physicians and to be in the audience just as the clinician might be. So patient-included congresses is one concept that is growing in importance. And that's something that we support companies who would like to make their events be patient-included, because that's an official self-certification. And the second thing is to bring to physicians digital tools of all sorts that will improve, reinforce the physician-patient relationship, even clinically, by either collecting data or by promoting tools that will improve the patient's engagement in that particular disease area.
So talk to me about your views on new technologies, specifically virtual reality.
Having been involved in digital health for many years and seeing the downsides of many of the tools that were brought forth, I always wondered, why is that? And I realized with the advent of virtual reality therapy that it was logical that the earlier tools were not scooped up by physicians. So electronic medical records and apps in general create a problem for the physician, is that they're more about putting information in a particular place than actually about immediately improving the situation of the patient. There are multiple conditions related to the central nervous system in which virtual reality therapy works. I can give the example of patients that I have met and presented with at large clinician congresses, such as the woman who gave birth without artificial anesthesia, thanks to virtual reality therapy. She indicated that she thought that it had been maybe 15, 20 minutes, it had been a few hours, when the obstetrician that was attending said, okay, it's over, this is the final thing, the child is about to be born. And she couldn't believe it. She'd had a first child with regular anesthesia and local anesthesia, and did not want to have that experience again because she didn't feel that she and the child bonded as quickly. And she's now had 2 births, because I was in touch with her again after a 3rd birth very, very recently. A young man who has Crohn's disease, who really suffered terribly, who actually became addicted to analgesic drugs, was able to get over that with virtual reality therapy. Various forms of surgery where the anesthesia is being used, cerebral palsy, where the patient becomes less rigid, his muscles relax under virtual reality therapy. Veterans who are using this to get over the trauma, exposure phobia, a big one, where there is proof that's been published in highly rated scientific journals about the fact that with virtual reality therapy you get better results than with psychotherapy. Now, I'm not saying let's get rid of psychotherapy, but that this as an adjuvant can get results quickly. Oh, and let us not forget dementia. By using what they're calling reminiscence therapy, you can expose a person to a familiar situation from the past and bring them back into that memory.
Some wonderful examples, but are there any things that we should be concerned about with this new technology?
Now, of course, I'm not going to overlook the fact that we don't know everything about virtual reality therapy, that it's not for everybody because maybe they can't wear the headset or they can't get into this. We have to look into what happens over time with too much use of this. Could there be addiction as there could be for anything else? So I'm not saying 100% go there blindly, but what I am hoping for is that there are people who are suffering in so many conditions that we could help them. One perhaps big area is during chemotherapy, to help the patient escape to another location, for example. But why I also like this is that it truly means that we are seeing through the eyes of the patient. In order for this to work, that's what it is. It's a therapy that can only work if the producer of the content sees through the eyes of the patient.